I'll introduce our next speaker, Dr. Rashmin Gandhi. Sir has done his training at Shankar Nethralaya. Subsequently, he's a double FRCS from Glasgow and Edinburgh. He is a brilliant academician, a wonderful teacher, and from personal experience, he is an inspiration to me as well. And then, after spending many years in an academic training institute like SN, he was involved in innovation, and he spearheaded the construction of a mobile eye surgical unit, or MESU as it's fondly called. It's basically a modified bus in which you can conduct cataract surgery. He works very closely with IIT Madras, where he's an adjunct faculty for the last 15 years. He is also an entrepreneur and has now interests in different continents. So he's donned many hats during his career, and I'm sure he will continue to do so. So with that brief introduction, I would like Dr. Rashmin Gandhi to speak to us on looking beyond ophthalmology and career options beyond ophthalmology.
Thank you, Dev. I think with my hairstyle, I have to don a lot of hats. Otherwise, the heat is little intolerable. Yeah. So this will be a brief, more like a discussion, because there are no like FRCS or ICO. There are algorithms and there are clear pathways, and you follow it and you achieve it. While life does not come with algorithm, it's like it's 360-degree open once you have given all these exams, and it's up to your interest and your way of life and your further aspiration, which leads you to wherever you need to go. So I would just probably just highlight as to what are the examples that I've seen or have experienced, which a lot of people succeed in. And this is not really, I don't know whether you have seen the program for this AIOC. They have certain cultural programs today, but also on Saturday, there is a cultural program. It's called Life Beyond Ophthalmology. And obviously those, and there is a huge participation in whatever goes on. We had during COVID, we had few competitions which we conducted online, and the amount of talent that the ophthalmologists came up with was absolutely amazing. Especially we had conducted a singing competition, but there are people who are doing different kinds of competitions or platform. Of course, those are more for as an interest, but can you take anything apart from ophthalmology as your career option, or something which is allied to ophthalmology as a career option, and succeed or go higher? There are quite a few, not maybe I know of two people from India, but there are quite a few from abroad who either during residency or after residency take up an additional degree. And one of the popular degrees is MPH. There are people who go into public health, Master of Public Health, and there's tremendous amount of scope, opportunities and money in public health because of, and especially after this pandemic, there's a lot of interest in what really works at an individual level and also at the community level. And these are public health specialists are the people who deal with it. There are some amazing programs which are open to ophthalmologists, and I know of one of our colleagues who did MPH from Johns Hopkins Bloomberg School of Public Health in Baltimore. And then you get invited to a lot of these global organizations like WHO. You're part of governmental bodies who would decide as to what the policies are going to be. The other stream that I've seen quite a few people take and succeed, not necessarily only ophthalmology, but doctors, is as a part of second degree is MBA. Now MBA has become quite sought after degrees because of corporate which are going around in India, which are practicing. A lot of ophthalmologists would like to practice in corporate sector, and MBA comes in handy. Same with entrepreneurship. People who want to do their own work, either ophthalmology or some other business. We generally don't know about finance, we don't know about policy making, and MBA gives you that added opportunity. We have a physician who did his MBA and then went for one of the boot camps, as they call it, at MIT Boston. And he did so well that now he has become a faculty for, though he's a physician, faculty for entrepreneurship at MIT Boston. So with all these different excitement and interest, especially in India, in entrepreneurship and business, some of these work very well. The third area which a lot of early mid-career doctors go in is technology. There are a lot of technological institutions who look for doctors as partners, research scholars, and even faculty, because healthcare technology innovation is something which is at the forefront in most technological development. Apart from environmental impact, healthcare is something which is really exciting for a lot of institutions, and you get a sizable recognition and a good amount of money if you join as a consultant in these, and you really don't require a lot of training there, because you're going there as a consultant to feed them about the healthcare and what is required, and what are the gaps in healthcare, or how do they work on technology. And then there are a lot of opportunities. It's not really beyond ophthalmology, but opportunities outside India, not necessarily only in UK, US, or Middle East. There are a lot of organizations who work in the Middle East or in Africa, where there is a lot of excitement and there is a lot of work which is going on. So that's something which is a good option for an early career doctors who can go get exposed to a new culture, do a very high amount of surgeries, and also earn a good amount of money. So these are, I think, some of these. Obviously, this is not an exhaustive list, but something which were my thoughts.
Of course, I mean, it cannot be a prescriptive kind of talk. But sir, if you have somebody in front of you today, a fresh graduate, postgraduate, who probably is a first generation ophthalmologist or first generation even doctor in their family, disillusioned with the idea of doing clinical medicine or clinical ophthalmology, what would be your advice in a very general way that you could give, so as to so that this person can sort of broaden their ideas as to what to do in life?
So all three that I mentioned, if somebody is disillusioned completely with healthcare, then obviously a technological institution is a good, because as I said, there are a lot of opportunities to collaborate with them. If somebody is just illusioned not with healthcare but only the clinical science because of imperfections or what goes on in the society, then this administrative jobs, and there are ophthalmologists who become administrators and have done well. So MBA would be a good option for them.
Does anybody in the audience have experiences or ideas that they have themselves pursued or would wish to pursue? And if they're comfortable sharing them with us, we would love to hear those.
Anybody having a startup working with ophthalmology or not? Yes.
Please go ahead, sir.
So I've done an MBA. Well, it's a certificate in corporate innovation from Stanford, and that sort of gave me an overview how to look at new ideas for research, new ideas for startup companies, whether it's healthcare or any other sector. The key thing it teaches you is how to look at the financial aspect first, and then there the idea dies before if it doesn't make financial sense. That has also allowed me to sort of laterally work as vice chair for the product evaluation committee of my hospital where I work at Cleveland Clinic, Abu Dhabi. So I don't look after just ophthalmology product evaluation. I look at product evaluation across the entire hospital. And that means, cardiology, cardiothoracic, you name it. I've also done a course from Berkeley on machine learning and applications in healthcare. So as we move forward towards developing artificial intelligence and other applications within the hospital, I'll be part of the think tank that, so there's lots of avenues to do things outside your comfort zone if you're willing to do that, because as you get old and as our hands start to not be as good as they are right now, we need to have avenues and interests to keep us excited and move forward, and also allows us to sort of keep ourselves employed.
Oh, brilliant. Thank you. Thank you for sharing this. Very good.
Fantastic. So I think that sums up the flavor of this session very well. that we have a lot of options after qualifying, and it's one may think that getting the degree MS or DNB is the end of the story, but it's actually just the beginning.